Okay, so I'm going to do a wet to dry dressing change. I would verify the order. Of course, the surgeon did the first dressing, and then I'm doing the second dressing the next day. So I would come in, introduce myself, inform the patient what I'm doing, medicate for pain if they're in pain, and of course, I would do that 30 minutes prior to doing the dressing change. I would ask them if they have any allergies, because if it was like latex or iodine, I would need to change it. Then I would perform hand hygiene, and then I would put on my non-sterile gloves. And then I would take my red bag out of my dressing change wound care tray. This is for wet garbage. And set that to the side. And then I would take the ABD pad off and check it to see if there's any drainage on it, how much, what color, and then I would put it in the red bag. And then I would remove the gauze, put it in the bag, and remove the packing. This is my wound. And I would assess the wound and only palpate the edges, making sure to look for pockets because they could potentially squirt it out. And then I would describe it, the color. This one's, we'll say, beefy and well granulated, it's healing. And then I would remove these gloves because they're dirty now and put them in my bag. And then I would get my sterile gloves out of my package and put my sterile gloves on. And then I would get my sterile, I would put this in the garbage, the red bag, and then I would get my sterile field out. Of course, this would kind of have more room, but and I would put all of my supplies on here. And then I would pour my saline into the container, which I'm not going to do for the sake of not ruining the saline. And then I would put my 4x4s and my gauze and everything in the saline. I still have some dries over here. And then I would measure my wound. It looks like it's 13.5 centimeters in length, 1 centimeter at the end of the wound, and 2.5 centimeters at this side. And then I would insert a Q-tip into it and hold that and look and see what the depth is on it, which looks like 3 centimeters. And then I would put that in my red bag. And then I would designate one hand for cleaning and one hand for supplies. And then I would clean the wound with gauze that was soaked in saline, getting the cleanest area first and then the dirtiest, and then put that in the red bag. And then I would start packing my wound. And so I would do like so. And this is of course soaked in saline. And you can use your finger or a Q-tip, and then sterile scissors to cut the gauze. And pack it in. Then you would cover with dry 4x4s. And then you would cover it with your ABD pad, glue line up, tape it down, and then of course you would date and sign and label everything at the end.